I'm going to introduce and kind of welcome in our wonderful panel of speakers. We have a bunch of experts from Health Roads, joined by one of our experts here at Bonterra. So we have Jill Guffey, who is the VP of Solutions Architecture here at Bonterra, and our Apricot wizard. So we brought in the big guns for you today. And she's joined by our friends at Health Roads. We've got Jason Popko, who's the Vice President of Marketing and Sales, Michael Linden, who's the Director of Sales, and Jose Reyes, who is the Senior Product Manager. These three and all of our prep calls have had like so much to say. Like, I love doing prep calls with people who are really excited and passionate about the topic. And this is a group of people who every conversation we've had, I've felt that passion and excitement. In fact, we were almost late to getting started because we were like still going through all of the like great things we want to talk about. So you're in for a treat. I'm really excited to talk about this partnership. And I will go ahead and take my back seat and let the experts take it away.
All right, we're going to start with a poll today to see what is important to you. So when the poll pops up, please take that poll so we can see what is important to you and where you're at in the landscape of outcomes and revenue. So hi, everyone, and welcome. We're excited, like Amanda said. Thank you for joining us for this webinar today. We are talking about something that's reshaping how social impact organizations sustain their work. Connecting outcomes to real revenue is important these days as the markets change, as grants become more competitive, as you're wanting to expand services. Some point, billing is one of those roads that you go down or you need to go down. So we're excited to show you a new solution we have for that today. Like Amanda said, I'm Jill Guffey. I'm the VP of Solution Architecture from Bonterra. I have been around for almost 20 years. I was a customer for 7 years and then have been on our solution architecture team for 12 years and lead it today. And I'm thrilled to be joined by the Health Roads team. We have worked with Health Roads for a long time. They've been one of our implementation partners that have implemented our solutions for our customers. And they have brought a new solution to the market called SocialRCM that we're excited to share with you today. It integrates seamlessly with Apricot. And so nothing you need to worry about there of how do these things connect and work together. We've already taken care of that. And we're excited to talk to them today. Do we have poll results? What does that look
Yeah,
like?
I'm going to go ahead and share those out. So looks like a good combination of folks doing both. Majority of folks, if they're doing one or the other, kind of in public benefits over private insurance. Some folks doing none. So good combo here in the audience.
Awesome.
Thanks for sharing, everyone.
Yeah. All right, well, let's start by grounding us in what we're here for today and what we're doing. Because every one of us knows that there's a struggle between doing good work and having it funded well. This is an option I think that you'll be super excited to learn about. And what we see at Bonterra is that most of the organizations we work with have incredible programs. But when it comes to billing or reimbursement, it's often outputting information to spreadsheets, to some sort of PDF, to late nights, trying to get this all aggregated up and sent to the right places. The data lives in Apricot, but doesn't make it to the billing and finance solution team in a format that can translate to dollars coming back in. And when we've been talking to some customers recently about this joint solution, they have thousands of dollars, tens of thousands of dollars stuck in this billing cycle with their insurance payers. And so Health Roads has been able to unlock those. And some of the challenges that we see and hear from these customers are on this next slide. And so I'm inviting our Health Roads partners to walk through some of these now.
Hello, thank you. Hi, I'm Jason Popko, Head of Marketing for Social RCM by Health Roads. Thank you, Bonterra, for inviting us to this discussion, and Amanda for kicking us off. And Jill, I really appreciate you setting the stage. It's really important, this conversation that we're talking about, because delivering your mission is really important, but how do you get the funds to make that happen? So we're really excited to talk about Social RCM today. It's RCM platform that we specifically built for community-based organizations, nonprofit organizations, and government agencies, so that they can get reimbursed for the important services that they have delivered. But also, we're really excited to talk about how this partnership between Apricot and SocialRCM is really a powerful duo to be able to continue to deliver services and then to be able to turn that into a revenue stream and to really remove, not only with our platform, but our white glove services, to sort of get over some of these challenges. And noting about the poll, there's quite a few organizations here today that already are billing, and there is a big chunk that isn't. So this conversation is going to be perfect for both of you, both types of organizations. Since we're experiencing this space, we know the challenges that you are experiencing, or when you take that first step, that you're going to most likely encounter. And we built a system and services to be able to help you get over those. These are the ones that we continually see pop up. If you have other ones or these resonate for you, please drop it in the chat. But beginning on the top left is amplifying what you talked about, Jill, fragmented systems. You may be working in a really powerful case management solution like Apricot, but you may be using different pieces of data as well to be able to get your job done. But now you have to turn into a bill, a reimbursable claim. And that's where SocialRCM can absorb all that from different systems and really convert it into a clean and compliant claim. And then moving down the next pain point, frequent claim denials. So yeah, you have these fragmented systems, you live with them, you get through it. But at the end of the day, the real pain is when you try to submit that claim and you did all the work to get it sent, but boom, it gets sent back as a denial. So you haven't gotten paid, the clock is ticking to get reimbursed, and now you have to do this work all over again. And like, how do you get that done? So that's where we'll be talking about what that looks like through both our platform and both with our managed services. And then bringing you to the bottom right-hand corner, time and resource drain. One of the most important resources we have is time. And if you spend it wasted on painful billing paperwork, you can't get that back. But imagine a world where you can reduce that administrative burden across your workflow. And so you can turn on a predictable and sustainable reimbursement revenue stream. Everything from just staying working, doing what you're doing, delivering your services. But on the back end, the magic is happening to be able to submit those claims and really see your claim volume and going up and your denials going down. So those are three of the really big problems that we're seeing out there. I don't know if Jose or Mike, if you want to jump in and add some color to some of the other ones that you specifically see, but that's really, these are the challenges that SocialRCM solves.
Yeah, Jason, I think my favorite one has been that when there's a change in policy in the social service billing programs that we've seen, and all of a sudden there's an urgency to get some of these claims out the door. Most of the clients that we've started working with before they adopted SocialRCM as a platform had to go in and submit a ticket to their systems and basically wait for a whole development cycle to implement the change. Or if they could not do it, that they have to wait sometimes weeks to months for the new feature to be implemented. And so that in itself causes a bit of a delay, not only in the implementation of the feature that they need for billing, but also the timely filing that could potentially make the claim unpayable. So in some instances, there's also a sense of urgency that some of these systems, case management systems, EHRs, are not really taken into account because of how dynamic social service policy can change.
I think that's what's great about the partnership between us and Health Roads is that the flexibility of Apricot to be able to configure quickly these new changes that are coming down from the regulations and the payers can be configured easily in Apricot, and then make sure that is updated to the SocialRCM system as well. So we're excited to take that blocker out with you.
Good points. It almost goes to the top of the challenge list. You ready to go to the next slide?
Yeah. And so, I think that's really where all of this comes together is that, being able to have Apricot plus SocialRCM be systems that can be updated quickly and keep you all on top of all of that to ensure that we're providing effective services through the case management and then being able to bill And I think that brings us to the next slide about the benefits of the social RCM platform. So excited to go through these too.
Absolutely, and so am I. Welcome, everybody. I'm Mike Linden here, Director of Sales with Health Roads. I'm excited to be here with our partner, Bonterra, Apricot. Jill, Amanda, thank you so much for inviting us to be a part of this chat. Been in the industry now for just shy of 15 years. The product here is absolutely amazing, and I'm glad I get to talk about the benefits. So we just went over some of the challenges, the negative side of things that can happen day to day, but here are some of the benefits of our social RCM product. These are just a few. Like they were mentioned before, we could have created slide after slide after slide about some of these benefits, but these are just some that stand out the most to myself. That's the increased collection rates. Having our system have the ability to improve reimbursement rates due to our automation is one of the biggest factors. That's both with claim submission and denial management. Social RCM will also reduce administrative costs, minimize all the manual processes and lengthy paperwork that can sometimes be time-consuming. Overall, just not a friendly atmosphere to want to be conducting the billing out of. So reduce administrative costs through those manual processes and paperwork. Social RCM will automate and streamline those workflows. That brings down the cost reduction as well. Here's the speed of things. Acceleration of the cash flow. Having the ability to utilize RCM, social RCM allows the ability to speed up payments. And this is with the automation and streamline workflows we mentioned in the prior. This allows claim submission and proactive follow-up processes to get these claims out the door faster, quicker, and reimbursed faster and quicker as well. Regulatory compliance. Social RCM also stays up to date with the ever-changing healthcare regulations and payer requirements. Those of you working in the space obviously know that those regulations and requirements change weekly, monthly, annually. You never know when they're going to change, but they change often. So our system is adaptable and keeps up with those ever-changing atmospheres in the compliance and regulatory factor. And reducing of denial rates. This is a big piece. We talked about some of the challenges being denied claims. Why are they denied? Social RCM has a complete overview, and it tracks and minimalizes all the clinical, technical, and administrative denials, thus improving the first pass yield percentages and resolution rates. So being able to get the claims out the door cleaner, quicker, compliant allows the money to flow back cleaner, quicker, and compliant as well. So definitely some of the benefits we like there. I wanted to kind of move maybe to the next slide as well to kind of talk a little bit more about our partnership. Partnership here between Bonterra and Health Roads. Like I mentioned, we are implementation partners as well. But Apricot already is already where so many of the managed outcomes, case data, it's where your team and your systems live in every single day. By this partnership and integrating social RCM with Apricot, we're making it effortless to connect those data points. That allows direct into billing workflows without double entry and without exports. Our pre-built integration and coordinated implementation means clients don't have to stitch together solutions themselves. Fragmented systems, looking for information here, pulling it from there, putting it together, building it out through an Excel form, however it is tracked manually. This is a proven solution that provides a turnkey approach rather than that do-it-yourself type of project. Your case managers do all the documentation up front as a service in Apricot. Social RCM handles the rest. We identify billable activities, we generate the claims, we submit to the payers, and we work on the denials. This partnership is very powerful because it allows you to focus on clients and allows us to focus on the revenue. And together with this partnership, we deliver a complete solution that neither of our products offer alone. So once again, thank you all for having us. This is an amazing partnership and definitely looking forward to the future. Together we grow. So thank you, everyone.
And I want to double down on what Michael said about your staff as far as case managers and those delivering services. won't be in SocialRCM. We're going to give you a demo of that platform in a moment, but there's no added layer of complexity to this, to the front end staff. Your billing staff are going to get new tools, and finance staff are going to get new tools to ensure claims are being paid and everything, but there's no extras for the staff to do besides maybe another couple of fields that they'll fill in, right, to ensure that the right claim data is input into the system. But I love that we've created this connection with Health Roads that automates that data transfer so that the right people have the right level of knowledge, and that everything is very seamless through the two systems. It was really a no-brainer when we started talking to Health Roads about their SocialRCM system and wanting to partner and bring this solution to our customers. And that's why you all were invited to the webinar, is because I think we have a really great opportunity here for you all to streamline billing and make it super simple for the staff. And, at the end of the day, I think for operationally, both of our companies, simplifying data entry and simplifying things so that you all can focus on your mission is both of what we're interested in doing. And so that's what this partnership really allows. And that's why we wanted to bring this webinar to you today. So I think, what rubber meets the road is show me, right? Yeah. Show me Health Roads team. Like, have you made this work? Give me a good story. Just like as nonprofits, you all are asked to share stories of success. We want to see one as well here. So next slide shows a little bit of a success story for you all.
Jose, do you want me to jump in regards to TPF, or since you were hands-on, you've got a great story of the backlog of revenue that you were able to get unstuck?
Sure. So this is the client that we were working with since about July of 2024. And this client specifically had a challenge in getting a lot of claims out the door for behavioral health and then also for some enhanced case management services. If you're in California, you probably are aware of CalAIM and some of the programs associated with it. This particular organization was actively working in the ECM, or Enhanced Case Management Program. What I wanted to also add to the pain points, because they experienced it, is that there are policies out there. Payers put out policies, states put out policies about how to build these things. But what we found is that there's very little coaching in the sense that you can get all this information, but when you're actually trying to apply it, you have questions, you're trying to make sense of it. Sometimes it doesn't make sense. You're doing the very best that you can. And often that's not enough. You'll get claims coming back and you'll get denial saying, oh, incorrect modifier procedure code combinations, or this is not a payable service. So it really frustrates a lot of clients. And in this instance, Therapeutic Play Foundation was one of those clients that came to us with this amount of frustration because they were seeing these chronic denials. And so they asked us to come in and say, hey, help us do this right. And so we partnered with them, implemented SocialRCM, and essentially managed to address their backlog of claims, which was around 300,000, in excess of 300,000. And we were able to get those out the door and reimbursed. And most of these claims were already nearing the timely filing dates of about 180 days. So they came in just in time for us to be able to adopt this problem and being able to accommodate the solution effectively and make it automated and make it more streamlined. And in a second, the demo environment that I'm going to showcase the solution and is actually based on some of their metrics. So the story is that we were actually able to unstuck all of these claims for them from multiple systems. They had an EHR, a case management system, that was not able to do this effectively. We were able to process them through SocialRCM and get them the reimbursement that they deserved.
That's an amazing story. And we are turning this plane onto the runway now towards the demonstration. And so somebody just asked in the chat about, can SocialRCM only connect to Apricot, or can it connect to other systems? And the reality is it can connect to any other systems as well, we believe. well,
Yes.
me, that Apricot's the best solution to connect to.
Yes.
And we have several customers that are connecting now. And so during this demonstration, we're going to show you that. But Social RCM can definitely talk about other solutions they can connect to. If you are currently using Apricot, if you are familiar with this screen. This is what's called our document folder, where all the documentation for a client is held. April's a fake person in my demo site. And you'll see here where I have enrolled her into some programs. I've assessed her with a social determinants of health assessment. I've built a care plan for enhanced care management. And I've also built some services, right, in that big square. So as information is being entered into the case management solution, and we're putting in that service information, this is what's sent to Social RCM to be able to create those claims. So the front end, as far as people doing the work, is a case management solution like Apricot. And then when RCM comes in, this is the process. Once it goes into Apricot or another case management solution, then this is what happens on the back end. So we want to get a little technical for a minute before we run into the actual Social RCM platform. So if one of you guys want to talk through these boxes.
Sure thing. I can go ahead and elaborate a little bit more on this. I should kind of preface this by saying that many of our team at Health Roads actually have decades of experience in health and social service billing, and not only on the provider side, but also from the payer side. So this is to talk a little bit more from the perspective that we're very aware of how this whole system works. We're able to anticipate some of the potential pitfalls that providers are going to see in terms of their billing. And then also from the technical standpoint, how to move this data, how to move it effectively so that there are no jams on the road to reimbursements. And so with all of this, we also provide different mechanisms to make this data actionable and meaningful for you, so that if there are pain points in terms of billing, that we can be able to pinpoint those for you. And through our white glove service, just like Jason was mentioning, we're able to work with you to get those unstuck. So it's not only a technical solution, but it's also a kind of a wraparound professional services component that is also included. So Social RCM in itself works by extracting data. For those of you that were asking about, can Social RCM work only with Apricot? That's our favorite implementation, to be honest. That's the implementation between Apricot and to Social RCM, but we're also able to work with various EHRs or other case management solutions as well. So we're system agnostic in that sense. And we're able to essentially take that information from systems directly, either through an API connection that we can establish, or through a flat file interchange through an SFTP. We take that information, we then validate it. We make sure that we construct the claim in a way that it meets the payer requirements to ensure that there is a high level of accuracy and compliance and a very high degree of probability that the claim will get paid. When that happens, we then submit the claim in the way that most payers want their claim submitted, which is the EDI 837 professional services format, claim format, that we can then submit either directly to clearinghouses, or we can submit them to payers directly if they so need to. Even though 837 seems to be the most common, it is not the only one that we can accommodate. We can also accommodate other formats. We've seen payers not being ready to adopt EDI 837 for social services billing. So in those instances, we can generate either an invoice file or an Excel spreadsheet template that they want us to populate and submit those to the payers. After we submit it, we then receive, or we are on the lookout for those acknowledgement files. The EDI 277, if you're familiar with those, basically tell you if the claim has been received by the payer and it's in a kind of an adjudication cycle, or if it's been rejected. So we monitor those cycles, And then also we receive the actual remittance file from the payers, the EDI 835. We reconcile that with all the data that's gone out from Social RCM, and we're able to produce reports, actionable and meaningful reports that can then be worked on by your teams, by your financial teams, by your case managers, whoever needs to be able to address some of these challenges in conjunction with our professional services team. So it's not just here's reports, have fun. No, we can work with you on addressing some of those challenges as well. So from start to finish, we take the information, transform it, submit it, monitor for those acknowledgments and payment cycles, and then present the data back to you in a meaningful and actionable format.
Yeah, and every time I've presented this team with questions about what can be billed through there, the answer is always yes. So I had a customer the other day say, well, we have a housing program and we need to bill a daily rate for something. And so I text Michael, I'm like, hey, can you guys do this? The answer is yes, right? They have the ability to allow for all types of payments of things to different payors. And so we can work through that. And one of the questions that came in were, the forms that I showed in Apricot, would they need to be billed or are they already there? And if you already have forms in Apricot that have elements of that, right, that we can use those as part of the process. So staff aren't having to learn brand new ways to enter data, but maybe some elements, some questions can be added to those forms to make sure everything is there for the claims, right? So we can configure a little bit on what you have, or if this is like a brand new thing, we also have the ability to pull some of these things in through the template library so we don't start from scratch every time. So we have kind of a standard integration that can be configured for each client to have a starting place, but then we want to make sure it's individualized and it works for your staff, just like every other piece of Apricot works for how your staff do their work.
That's exactly correct, Jill. And just to kind of piggyback on that, our social RCM platform also aims to work as much as possible with the workflow that's already established. So if it's something that you're already doing, you're collecting data, we want to be able to leverage those pieces because it makes it easier for adoption. If all of a sudden we're asking you to reconfigure Apricot or reconfigure all of those forms, you're going to see some productivity lags. You're going to be seeing some resistance. You're going to be seeing a lot of challenges. So whenever possible, we want to do the opposite and adjust to you. So if you're already working with Apricot and you're capturing everything that's necessary, great. We're going to be working off that. But if there's some programs that, for example, require an additional field, that might be the minor customization or a configuration change that you might need, and then we can work with the rest. So it really depends. We try to accommodate as much as possible to the existing workflows that CBOs currently have.
Mm-hmm. Yeah, and there's a question about like how does this interface happen? And the reality is like we have a standard integration now with Social RCM and Apricot, and Health Roads would be the one that configures Apricot with you to match everything up and make sure that that data is flowing back and forth. So no other third party needs to be involved. It's just you and Health Roads to get this up and running. And at the end of the webinar, we're going to ask if anybody would like to raise their hand to have that discussion started, and we're excited to do that. Or at any point, you can reach out to your account manager and they can connect you. They've all been trained on this as well, so they'll know what you're talking about when you email them. All right, let's go and get into the demo part, and then I'll keep watching the questions. So I'm going to stop share here.
Sure thing. Thank you, Jill. Let me go ahead and share my screen. And I hope everybody can see my screen now.
Coming slowly.
Almost. There you go.
Okay, and I'm just going to go off camera. I'm still here, just for this to conserve some bandwidth on my end. So this is, like I mentioned a little bit earlier, this is a demo instance of that's based actually on the case that we mentioned, Therapeutic Play Foundation. And so we wanted to show you essentially the first landing page of Social RCM. This is an optional UI that you can log into. So as Joe was saying, this is a new solution that your financial teams or anybody that you feel needs to have access can also have access to in addition to Bonterra. So the landing page here essentially tells a little bit of your financial health of the organization in terms of some of these social service billings. So you're going to be seeing some of the monthly revenue trends. You're going to be seeing your payer mixes. You're going to be seeing some of your rates in terms of collection rates, average days to payment, clean claim rates, denial rates, all of these components that are necessary to basically diagnose the financial health of your organization. So in this instance, I wanted to zoom into this particular graph because this is exactly the case that we found Therapeutic Play Foundation in. We saw them undergoing a EHR transition, which was also contributing to the backlog. So I wanted to highlight here these green, teal, and blue blocks because this represented the backlog of claims that they were seeing, about in excess of $300,000. And all of these claims were because of services that were missed from billing, services that needed corrections, services that had to do with retroactive enrollments of some of those clients into a managed care plan. And really, they had to move a lot of these claims out the door first before they could even begin addressing some of the more current services that they were actually rendering. And so we came in to help TPF in July of 2024. And over the next several months, we were working with them to address this backlog. And as you can see here, these blue, green, and teal blocks are basically decreasing in size as we progress through the months. And our current services billing actually expanded. That meant that the backlog of claims was getting reduced as we were working with them in every cycle. And then also we were helping them to start getting up to speed with their more current billing. And so all of this to indicate that we were bringing down their average days to payment, meaning the date from when the service was rendered to the date that the service was paid. So almost immediately we were taking this from about 180 days down to about 42 days. Now they're actually hovering at about 28 days or so. So we need to actually update this demo a little bit, but this is to indicate how through automation, our not only high-tech solution, but also through our high-touch solution in terms of the professional services component, we were able to bring this down. We were able to bring in some of these net collection rates back up. We're still a little bit under that 95 target, which is our Health Roads target. And same thing with some of these denial rates. We want to make these as low as possible. We also do provide the payer mix so you can see who you're actively billing so that you can use this information, see how the striation of the contracts that you have, and then also use this information if you so need to be able to renegotiate some of these contracts. Maybe you can get a better rates, you can get some better terms and establish a stronger relationship with those payers. All of this, again, just to show at a high level, how is the organization doing in terms of social services billing? You can see some of the trends across time, who you're doing business with, what are your rates, and that all of this information you can then use for optimizing your workflows, optimizing some of your configurations in terms of services within SocialRCM or within Apricot. All of this, again, just to help the focus and the attention that's needed for billing, but also, again, providing that in context of the services that are being rendered. Underneath this, all of these, this dashboard essentially is powered by some of these modules right here. So if you needed to see the information at the claim level, we can showcase that here. You can see who this claim was billed to, the insurance. You can see the status of it. You can see the amount, the date of service, so that if you needed to reconcile and see, do a deep dive of the claims for which clients that you've rendered services for, you can do that and you can do it effectively here. We can also identify some of the denials that come back and also apply a priority level to show you which ones you should probably attend to first. We also do provide the denial reasons so that you have an understanding and also that we can use to work with you to address some of these denials and be able to resubmit them back to the payer as corrected claims. We also do handle some services that often don't pass validation. So for example, if we get data and the client is missing or the claim is missing a date of birth, it's missing a service date, we're able to pre-validate it so that it actually does not go out to the payer yet. We can build some rules to basically hold the claim so that your team can then address it. And then once it's corrected or fixed, we can then revalidate it and then submit it to the payers. We can also showcase here a little bit more, another view, a profile view of each client. And you can see their some of their more demographic information, and you can also see some of their insurance information as well. And for your teams that are doing financial analysis or financial reconciliations, we also do provide a module here where you can track some of the payments. If you get a check all of a sudden, we can also showcase here from the EDI 835 data or any of the remittances that we receive, what the claim, what the check is for, or who it's from, what is the check date, what is the status of it, and then you can use this information again to do some of the reconciliation aspects of it. And then I'm going to kind of take you through a little bit of a tour here of some of the schema of how we're able to essentially bring in the information also in a flat file format. So here, I'm loading an input file, and we have a very flexible schema that we can then take the information and be able to map it accordingly. So not only do we capture demographic information that's needed for claims, first name, last name, date of birth, and address information, we also capture identifiers. We actually we capture programs, service category names, service names as well, and service expense amounts. We take that information, and if you have procedure codes, modifiers, diagnosis codes that you're already capturing, we can take that information. But we also understand that not everybody's capturing this. So we try to take as much information that we can about each service so that we can construct a clean and compliant claim. But we also understand not everybody's providing this. So in those instances, we try to use service category name, program name, service name, so that we can do an effective mapping. We also can accommodate prior authorization numbers if you have those as well. But also, because we know that there's a lot of dynamic changes in social service billing, sometimes we don't know what will be required. So for those instances, whether it's something that a payer needs, let's say they want the medical home, maybe they want an additional data element for reimbursement, we can accommodate those here in what are called user-defined fields. We can use this to submit data elements to the payer, or if we need to use them in our validation, we can take this information and use it accordingly. After we bring in the input file or the data set via the API, we then can construct rules, and we can construct pre-processing rules. So for example, if we needed to do any cross-validation against, for example, an external data set, in ECM, for example, we have to cross-reference against the member information file. But we can also do other types of pre-processing or cross-validation rules, and we can construct them here. We can turn them off or turn them on or turn them off, depending on what is required. And then we can also create custom rules as needed. We can also do some input file validation rules. So if we need to check for the presence of a member ID, a specific format of the ID, we can do that. We can also identify specific services if they're happening multiple times per day, whether we should price one accordingly, or if we needed to apply a modifier so that it doesn't dupe out on the payer side. We can also do some output transformations as well. And this is what I was mentioning, that most providers, when they generate claims, they submit it as an 837 format. But for example, if we needed to create an invoice file, we can do that here. And we can provide the template and construct it, and then apply the rules that are necessary to populate that template so that we can submit it to the payer. And then lastly, if we needed to do any automated resubmissions, we can construct those here. So perhaps, let's say that you're getting a denial for missing claims, missing authorizations. We can take that information and reevaluate the claim and be able to essentially resubmit it with the authorization number that we find. And so we can construct some of these automated resubmission rules here as part of the solution. So all this to say that the solution is very flexible in the configuration aspects of it and can accommodate nearly all payer requirements. And Jill, I'm just kind of turning it back to you to see if there's any questions.
Yeah, so there's a couple in the Q&A. I think this one's we'll give you the tricky one first. So Naomi says, one of our programs uses 3 different service delivery forms. Is the mapping system able to handle that?
Can you elaborate a little bit more on that scenario?
I think maybe they have like 3 tier 2 forms that they're using to collect service information.
Okay. The answer is yes. As we may not need the entirety of the form. We might need just maybe a couple of data fields from each of the tier 2 forms. And essentially, yes, we can connect them and use them as validation and or submission.
Yeah, the Naomi said they have an enrollment visits, a discharge visit, and a progress notes form. So they collect that in 3 separate places.
Yes, then yeah, we can take that information, fit it into our schema, and essentially construct the claim. Yes.
Awesome. And then there's a question around, do you all have experience working with CHW services in California, community health worker services in California?
Yes, in fact, not only CHW services, but also the community support services as well, including Justice Involved.
That's awesome. And there's the big question is, what does this cost? What does this cost, Michael or Jason?
Oh, yes. Mike, go ahead, Mike, if you want to jump in. I saw you were
Oh, go ahead, Jason. I'll let you kind of explain that out.
Yeah, thank you. I saw there was a question in there, and thank you for asking it, Jill. Well, that's a very important question because our pricing is aligned with the success of every organization that we work with. Every organization wants to get to that reimbursed revenue. We don't get paid until you get reimbursed. So the way it works is that it's not based on transaction or anything like that. Is as your claims go through the system and they get successfully reimbursed, and you have received that reimbursement funds, that's where Health Roads gets paid off based on your reimbursement revenue that you received.
Yeah, and I'm just going to take this opportunity. I know Jill mentioned we're going to put up a poll for folks who wanted to learn more. So if you wanted to get into the weeds about those additional details, pricing, integration, see a more in-depth, robust, personalized demonstration, like really kind of get into the thick of how this would look for your organization, go ahead and fill out the poll on the screen. So we kind of know how to follow up with you, who to follow up with, and I'll leave that up for a few moments. Again, if you're somebody who was asking some of those nitty-gritty questions, it's a great opportunity for us to just be able to follow up with you. So I'll leave that one up while we pick out some other questions from the audience.
Yeah, and keep putting your questions in the Q&A. They've been great so far. I did want to follow up on the cost question. If you currently have Apricot 360 or Apricot Enterprise, or you've already added on API or secure file transfer to your licensing with us, then there's no additional cost. If you have Apricot Essentials or Apricot Core and you don't have integrations, there would be an opportunity to upgrade to Enterprise or add on the cost to have integration. So that would be the only cost on our side. And then there would be a little bit of configuration that needs to happen to get Apricot matched up to the SocialRCM platform. And then from there, everything like Jason said, when you get paid, they get paid a tiny percent of each of those claims.
Thank you, Jill.
Yeah, and I know one question we get about kind of the getting started piece often is, how long does that take? So I don't know if someone on the Health Roads team is willing to share how long does it take to implement SocialRCM?
I can take that one, Amanda. Thank you for asking that question. We realize that's really important for organizations. If you're currently billing or doing it, you haven't started anything, is you want to be able to get to that reimbursement, sustainable revenue stream as quickly as possible. We're very experienced in doing this with our knowledge with previous clients and the way we've configured our flexible system. So you can expect around about 4 to 6 weeks, depending on what you're currently working in, to be able to get up and running. So that includes like the discovery phase, moving through testing, and then getting your live claims getting submitted. But with the partnership and our experience with Apricot, we're monitoring that very closely, and we expect that time frame to reduce drastically.
All right, so we have someone who wrote in and said, we're doing all this manually right now. We have a report that's generated from Apricot, a staff member who re-enters that into the EHR, which is ARA. That staff member also verifies insurance information that our staff have entered into Apricot. All of this can be automated with the SocialRCM platform.
The short answer is yes. In fact, that's actually what we do for our current clients. And the cadence can be whatever you want it to be. So for example, we have some clients that want us to submit claims weekly on a weekly basis. Other clients that want us to do this submission on a bi-monthly basis as well. So it really depends. But yes, we do all of this. Not only the validation for data completeness, but also the insurance information validation as well. And if there are clients for whatever reason that when we look up their claims or their eligibility information and it's not active, we do hold them. We don't submit them so that you can expect a no eligibility denial. We do hold them until we requery in the next cycle to ensure that perhaps there could be a retroactive enrollment. We've seen clients do that or handle that where they're kind of rendering services before eligibility is established, kind of going off the word of what the payer is saying. And then once we formally see it in the data, then we can release those claims. So for those instances, we do hold on to the claim. But yes, as part of the validation, eligibility is one component.
And so there's a question about, what is the process to Q&A claims before submission? I think we've hit on it a couple of times, but to wrap up, like what Q&A looks like before submission.
Q&A involves not only analyzing what is coming out of Apricot, how it's being stored, but also effectively gauging the accuracy of the mapping. So for example, if you're doing case management and it is over telehealth, that the mapping is in accordance to your health plan contract. So if you have a specific requirement to bill at a specific rate, we want to be able to identify first how you're capturing the data. So, and on a consistent basis, we then review our mapping so that we can see the final claim. And we do that a couple of times, so over a couple of test cycles to make sure that we've refined everything and addressed any potential scenarios that are unforeseen. And so all of this is part of our discovery process to make sure that what goes out of SocialRCM is clean and accurate and also configured in accordance to how you're capturing data in Apricot.
I think important here too that we haven't talked about yet is the magnitude and the years of billing experience that your staff have. You're not just a technology provider, but you've been an implementation partner of ours. So really understand the space and how our customers are delivering services. But if you guys could speak to the magnitude of billing experience you have, because I think as somebody who worked in nonprofit who was looking at billing at one point, like that's the scary part, is knowing all the rules and how it maps and ensuring that we're sending things through clean and it's not going to get denied. And I think that's what's great about you all is the ability to shepherd that as well.
That's correct. And as I mentioned earlier, many of us have decades of experience. I myself have over 20 years in this space, and not only in the provider side of business, but also on the payer side. And so I can tell you a lot of things that payers would consider as they're reviewing claims, some of the guidelines, some of the technical difficulties that providers actually have to navigate through from the payer side. And so we took that expertise and we built it into our solution so that any pitfalls that we see from the social RCM or from the revenue cycle management side, we're able to essentially foresee and be able to come up with solutions to bypass it. So one of my favorite ones, for example, is when there's multiple services that are being billed for one client in a day. If you're not familiar with how to build these properly, you're going to be seeing a lot of denials for duplicates. And so there are strategies that we can employ to be able to essentially tell the payer system that, hey, this is not a duplicate. This is a different service that was rendered on the same day by a different provider. So there's modifiers, there's record types, things of the sort that we can employ. And that's where, again, going back to what I was mentioning kind of at the start of the demo, that there are policies, there are guidelines that payers put out there, but there's no coaching. So unless you have extensive experience on how to do medical services billing or social services billing, you wouldn't be aware of this. You would just be essentially seeing the consequences of denied claims. So you would essentially have to learn the hard way. So we take this experience, we apply it not only to the solution, but also to the professional services component so that we can mitigate all of these potential risks well before submission.
I like that. Minimizing risk in billing is really important. So
yeah,
I'm about that.
that's one of the things that I always like to say about social RCM, that not only does it generate clean and compliant claims, but also claims that have a high probability of getting reimbursed.
Yeah.
I always try to target 100%, but sometimes we don't get there because of things that are happening outside of the claim itself. So, but we try to stick to at least 95% as much as possible.
Yeah. We haven't seen any new questions roll in the last 5 minutes or so. So if you do have any last minute questions, please pop them in the Q&A so we can get those answered today, or we can definitely follow up, have a one-on-one session with you all and really talk through your programs and your billing needs specifically and what that implementation plan could look like to get you set up with social RCM and Apricot. So we're excited about this new opportunity.
Thank you, Jill. And sort of, you guys already talked about it, but I know Brent, thank you for asking that question about that percentage of successful reimbursement. Yeah, as Jose said, we want to get you to 100%. And there's a lot of things that we can control in regards to before we send that claim. But we'll always begin with, where are you, if you're already billing, what is your current reimbursement rate? Because that's going to be your personal, your specific benchmark that you have for you and your organization. And our goal is to improve it. And because of what we do in the pre-processing portion of our automation, we want to make sure we're only sending the clean and compliant claims forward. And we want then return to you as an organization the claims that didn't pass that threshold of quality. And so you have a chance to fix them before we send them through in the first time. But the overall goal, and you'll see, maybe notice in the dashboard, is we'll set in those benchmarks that you have, and we'll be able to report back what your reimbursement rate is. And not only is all this experience built into the system and our proprietary business rules and algorithms and our AI to specifically do it for your contract, the managed services, we can't emphasize that enough. Payers are complex. Our systems are also, we're trying to build that complexity in there. We're continually refining it, but we have experts like Jose and our revenue cycle management service team that are there to bring that human insight into sometimes those confusing codes and confusing bits of data so we can feed it back into the system and continually to squeeze down those denials and making sure your services you're delivering are getting paid as quickly as possible.
I think those services, that's really what gets you to that success point, that human, we call it the human in the loop, right? That's,
yep.
It's got to be in there interpreting what's happening and pushing the right things to try it again, to try that claim again. And that's what I appreciate about you all too.
And we're partners in that process because we want to reduce that human administrative burden of repetitive tasks that we can then program into the system so we can then use, this is a perfect example of where like the good story of AI and technology, like, and then the experience of each one of us and these humans, we can move up to these higher level tasks that require our experience on both sides, from the provider side and from us sitting in between you and the payer. But we continue to refine the system, but we have the people to help.
Awesome. Well, we are sneaking up on time here. I think that we've covered all of your great questions. But again, if you did want to have a follow-up call and discussion, let us know. I'll pop one last poll up in case you missed the last one. I'll leave that up while I spend some time thanking our wonderful panel of presenters here. Jill, always a pleasure to get to work with you. You bring so much to the table here at Bonterra, and one of the many things was also having this relationship with Health Roads, and it's been really awesome to learn about all of the great things you all are doing and trying to simplify and make everyone's lives easier, which is, I know, kind of what we're all striving to do, so that you can all keep doing the good work that you're doing. So yeah. Jason, Michael, Jose, thank you so much for joining us. We're really excited to continue this conversation. Hopefully this will be the first of many webinars that we get to do together. It has been an absolute pleasure, and I just wanted to thank you all and thank our audience for hanging on with us and spending an hour in your day with us and this team. I know an hour is a long chunk of your day, so thank you. We appreciate your time, and we hope to see you at our future sessions.
Sounds good. Thanks so much, everyone.
Thank you, everyone.
Thank you so much.
Take care, all.
Bye-bye.
Bye.